Hi students, this is Dr. Ways and welcome to your lecture on the hand. So looking at the hand is similar to looking at the foot, where we have carpal bones instead of tarsal bones, metacarpals instead of metatarsals, and then the digits of the hand that are numbered 1 starting with the thumb to 5 starting with the little or ending with the little finger. All right, and then there is a point of a midline point, which is the middle finger for the hand. Unlike for the toe, remember, or for the foot, remember it was the second digit. So anything taken away from the midline of that middle finger would be abduction, and anything added back toward the middle finger would be adduction from either side. Another difference is instead of just numbering them 1, 2, 3, 4, 5, you have the thumb, the index finger, middle finger, ring finger, and little finger. So digit numbers and that nomenclature can be used interchangeably. All right, another important thing to notice about this, and I think I mentioned this in the overview as well, is that the metacarpals, even though they look like individual finger bones, they are within the palm of the hand. So within the palm of your hand, you have these long bones, these metacarpal bones, and your carpal bones are more in the actual wrist itself. Okay, so your metacarpals are not physically separated from each other when it comes to the skin that is overlying them. Another difference that you'll see with the hand and the foot is that they are two sides. The one side that is associated with the thumb, the fleshy part of your thumb, is called the thenar eminence, and then the fleshy part of the opposite your thumb, associated with your fifth digit or your little finger, is the hypothenar eminence. So if you put your hand with your on a table with your pinky facing down, like that hand is, the thenar eminence is going to be superior, and the hypothenar, meaning under the thenar, is going to be inferior. And so that's how that got its name. So in the general overview, we talked about how the bones of the wrist and therefore the hand have this arch, this carpal arch to them. And what's holding the two ends of the arch together is this piece of connective tissue called the flexor retinaculum. Flexor retinaculum. So what that tells you is that everything that is going through or underneath that flexor retinaculum, or that tunnel known as the carpal tunnel, is going to be associated with a flexor muscle. Now notice there are no muscles in there. There are tendons from muscles. So where are those muscles located? Those muscles are located in the forearm. All right, so they're going to be in the muscles for these tendons are going to be in the anterior compartment of the forearm. All right, what else is in that carpal tunnel? The median nerve. That's going to be really important when you have carpal tunnel syndrome and you have pain and numbness and tingling in your distal digits. It's because that median nerve is being compressed, and so they need to release that somehow, and usually they will release that by cutting the flexor retinaculum in order to relieve some of that pressure within that area. All right, there are different compartments associated with each one of the carpal bones that have their own separate connective tissue separating them from each other. And so you have compartment 1 over here on the lateral side, the second compartment here, if you look at it being close to the bone, it's the next one that's closest to the bone, and then the one just outside of that, just superficial to that, would be the third compartment. And notice we're going medially. The fourth compartment right here, the fifth compartment here, and the sixth compartment here. Right, and the tendons that are associated with each compartment are listed in the gray ones here. And as we go through the muscles, I strongly recommend you coming back to this particular slide and taking note of which compartment that those tendons for those muscles are associated with. However, I will say that if you look at them, there's a commonality between almost all of them, and that they are almost all extensors. The only exception is this abductor pollicis longus tendon, and remember what pollicis refers to? It refers to the thumb. So that would be abducting the thumb. All right, and superficial to that flexor retinaculum would be the ulnar artery. You can see right here on the lateral portion, or I'm sorry, medial portion, and the ulnar nerve just medial to that. Another way to look at this, the different compartments that are associated with the extensors, remember that they go from lateral to medial, and they're associated with each one of the carpal bones. So compartment 1 would be associated with the trapezium. Compartment 2 and 3 would be associated with the trapezoid. They both begin with T. Compartment 4 here would be associated with the capitate. Compartment 5 associated with the hamate, and compartment 6 right here would be associated with the triquetrum. The connective tissue of the hand and wrist are going to be very complex, so I'm not going to be that concerned about knowing every little last detail about them. The major one you should know for sure is the flexor retinaculum, because that's going to be really important and clinically relevant because of carpal tunnel syndrome. But I do want to point out that there are these tendons going through the carpal tunnel, and they're going to go to each one of the digits. And just like we saw in the foot, they are covered in this synovial sheath so that they are lubricated and can move fluidly without much friction. But on top of those, we have these fibrous digital sheaths. All right, so these fibrous sheaths that protect not only the synovial sheath but also the tendon that's underneath them. So it's not like you just have tendons that are pulling on bones. They are in a very complex network of connective tissue that provides not only a functional ability to move the digits but also protection against damage to those tendons, to those cords that are causing the movement. All right, so this is the palmar view of the hand. And then if we look at the more superficially at the palmar view of the hand, we notice that we even have more connective tissue on top of that, which is associated with other muscles that are going to help movement in terms of finger flexion and grasping things. All right, this picture is just designed to point out that we have two bursae of importance in the hand. One is the ulnar bursa, and that's over here on the ulnar side. And of course, remember, a bursa is to protect bony parts from damaging soft tissue. So you have this bursa here protecting these tendons from bony tissue, and the skin up here from the bony tissue lying underneath. And then you have the another bursa right here for the flexor pollicis longus and radial bursa. Okay, another one of those important landmarks that you should be aware of. So, you know, this is associated with that surface anatomy that we talked about with previous lectures. And it's called the anatomical snuff box. And that is this triangle. Notice there's a lot of triangles in anatomy. This triangle right here that is on the most lateral side of your thumb. And it is formed from the tendon of your extensor pollicis longus right here. All right, so we'll kind of draw it out. The extensor pollicis brevis right here, as well as the abductor pollicis longus tendon. The floor of it is made up of the scaphoid and trapezium carpal bones that you see underneath here. But the importance of this primarily is that you have your radial artery coursing through the anatomical snuff box. Now, you're only going to see the anatomical snuff box when your thumb is in extension. All right, so it's not going to be there unless your thumb is in extension, and it's got to be just the right spot in order to see it. So I recommend practicing this on yourself, and also on yourself. Take your fingers, place them within the anatomical snuff box, and you'll be able to feel your radial pulse within there as well from the radial artery. Blood vessels to the hand, or blood to the hand, is supplied by the ulnar artery as well as the radial artery. And you notice they form this arch, this superficial palmar arch right here. And then from that arch, the arteries spread out to each one of the digits. All right, these digital arteries, palmar digital arteries. And if you look at this picture here, it's mainly the ulnar artery that supplies digit 5, 4, 3, and half of digit 2. Then it would be mainly the radial artery that would supply the other half of digit 2 as well as digit 1, or the thumb. Alright, so the way this is organized is the ulnar artery comes around, forms a superficial palmar arch, which then arches back around and anastomoses with the radial artery, and then the radial artery forms the deep palmar arch, supplying blood again mainly to the thumb and digit 2, and then anastomoses on the other side with the ulnar artery. Again, a redundant blood supply just in case blood gets cut off. On the dorsal side, we have the dorsal carpal arch right here, coming from the ulnar artery, and that's going to branch out into the dorsal metacarpal arteries, which are then going to branch out into the digits as well. Venous return, we have our dorsal digital veins draining blood from the hand, and they are all going to meet at this dorsal venous arch. And so you see this dorsal venous arch on both of these pictures right here. Collectively, where all of the digital veins are merging into the dorsal venous arch, it's called the dorsal venous network. And then that's going to drain up into your cephalic vein on the lateral side and your basilic vein on the medial side, and continue to course upward in the arm to the vessels that we have discussed previously. Nerve supply, we'll start with the ulnar nerve on the medial side. So here it is coursing down the medial side of the forearm into the wrist, and then it's going to branch into your deep branch and your superficial branch. All right, the deep branch, which is primarily going to be motor, and then the superficial branch, which is primarily going to be sensory. And so notice that the ulnar nerve is going to be associated with finger 5 and half of finger 4 on both the palmar as well as the dorsal surface. The median nerve, of course, we saw is going to go through the flexor retinaculum and then branch out as soon as it gets to the other side of the flexor retinaculum, going distally into the palmar branch, which actually branches before the flexor retinaculum. The recurrent branch, which is recurrent going backwards towards the thenar area, and then continue on as digital nerves to digit 1, 2, 3, and half of digit 4. So if the ulnar nerve supplies digit 5 and half of digit 4, the median nerve supplies the rest of the fingers on the palmar side, but only the tips on the dorsal side. The radial nerve then, coursing laterally, Notice it's going to the thumb and then to the first two digits. And so it's going to fill in the rest, very little on the palmar side, mostly associated with the thenar region, but all the rest of the dorsal side of digits 1, 2, and 3, except for the tips, which were supplied by the median nerve in the previous slide.